Season 3 had some seriously good moments, and what better way to celebrate finishing it than by reliving the best ones, as suggested by OG channel subscriber Tree Poplar. Can you believe we're almost halfway through the series? Madness. So what was the funniest moment? Well, when the lady collapsed in Airborne and the lady of the day said, "Oh God."
Bran, is this okay? Bran. Oh God.
Oh God, not again. Why has God cursed me with such a venomous beauty? At least she'll have the paramedics on speed dial and probably know CPR since this happens so often. The most shocking moment is when we find out what happened to the patient in One Day, One Room.
Every patient who comes in here for an STD test has one thing in common. They had a SWS. Sex while stupid. How do you live to your age and not know about condoms?
I have an STD.
All you gotta do is take these pills.
Don't touch me!
I need someone to cover a patient. She was raped.
Oh, that's horrible to hear, but sadly it does happen more commonly than we might expect. Around 97% of women have been victims of sexual harassment and 1 in 25 victims of rape. That is less than the true stats though, as most people don't actually report it. The majority do happen while under the influence of alcohol and with the perpetrator being a current or ex-partner of the victim. One serious but horrible consideration though is if she got chlamydia, could she also have gotten pregnant? We know abortion law has been a point of contention in the US recently, but in these cases, even in the US, then 75% of people agree abortion should be allowed. Best diagnosis has to be the altitude sickness in Airborne.
Scuba certification card. T-Kong Scuba Rental, dated yesterday.
Oh, House has got it. Pang has decompression sickness because of rapid reduction in pressure. See, what happens is during a dive, body tissues absorb nitrogen from breathing gas in proportion to what the surrounding pressure is. At that pressure, the gas doesn't cause an issue, but if the pressure drops too quickly as he ascends, the nitrogen comes out of solution and starts forming bubbles in the tissues and can cause arterial gas emboli and blockages. The solution is rapid recompression or increasing the pressure again. That helps the nitrogen to redissolve back into the blood and the tissues. Oxygen really doesn't change outcomes here, but there are usually good outcomes if it's treated within 24 hours. Joint pain was relieved by the compression because the nitrogen that was present in the synovial fluid actually reduces in volume as you increase the external pressure on the bubbles. Now, that is cool. Saddest moment has to be in house training when Foreman realizes he just killed a patient.
Just the pressure of the BP cuff was enough to start her screaming.
Sounds like she's septic. It's an infection and we fried her immune system. Do an echo to confirm it's in the heart. We just killed her. I'll tell her. You're dying.
How much time?
Less than 24 hours.
What? Now you decided to invoke your oracle powers, Foreman. Could have done that before you made her marrow about as alive as respect for the Canadian Parliament after they gave a standing ovation to a Nazi. The truth is though, predicting when someone will die is actually very difficult. When I was on palliative medicine, I looked after hundreds of people who were dying, and the way we predict when there's about 6 months left is how quickly things are getting worse. If they notice their mobility getting worse over months, then there's likely months to live. If eating is reducing over weeks, then it's weeks to live. If conscious levels going down over days, then there's days to live. One thing I can tell you for sure though, people who predictably have 1 or 2 days to live do not look like this lady. They won't be speaking to you coherently or necessarily even aware of their environment, unless they're Queen Elizabeth II, who was doing public appearances up to 2 days before her death. Least accurate moment has to be the diagnosis from Top Secret. I still have no idea how hereditary hemorrhagic telangiectasia would cause his symptoms. Doesn't make sense.
Have a nice night? Yes, I did, thank you. The answer was staring right at us the whole time. As plain as the nose on our faces. He had it cauterized. Undoubtedly, because they were both born with hereditary hemorrhagic telangiectasia. He obviously has AVMs. AVM near the spine caused paralysis. AVM in his lungs prevented his blood from being filtered.
Hereditary hemorrhagic telangiectasia, you got to be kidding me. It's an inherited genetic mutation of blood vessels that classically causes these small red spots, especially on the lips and nosebleeds. You just need one affected patient to inherit it because it's autosomal dominant, and the usual complications are bleeding in the brain, lungs and gut. It doesn't stop blood from being filtered or oxygen from reaching the lungs though. That's going into astrology level science. Yet it's safe to say that the diagnosis was impossible to get. Pretty crazy. Now if they find the malformations though, then they can clip them off and he should be back to Marine training before you can say Dr. Mezho loses again.
Oh, boo-hoo! Let me play a sad song for you on the world's smallest violin.
The most interesting moment has to be House's origin story in Son of a Coma Guy.
When I was 14, my father was stationed in Japan. I went rock climbing with this kid from school. He fell, he got injured, and I had to bring him to the hospital. We came in through the wrong entrance, past this guy in the hall.
Oh, we're finally hearing House's origin story right now. Maybe we'll find out why he's so grumpy, yet so lovable. Such a multi-level character created by Fox and Hugh Laurie is really justifying the £250,000 per episode fee that Hugh Laurie was earning with this monologue.
It's a janitor. My friend came down with an infection, and the doctors didn't know what to do. So they brought in the janitor. He was a doctor and a baraku.
I love an underdog story. You might not know what a baraku is, but it's the social minority class who are not respected in Japan because of their ancestry. They're descendants of people who used to butcher and make tan leather, kind of impure professions. And so they are outcasts in Japan, looked down upon in some areas.
One of Japan's untouchables. His ancestors had been slaughterers, grave diggers. And this guy knew that he wasn't accepted by the staff, didn't even try. He didn't dress well. He didn't pretend to be one of them.
See, I know this is a fictional story from a TV series, but there's so much class discrimination out there in the world, and we need to do better to actually address it. I mean, not everyone starts life with equal opportunities, but as they move on, they should gain them. You can judge a society by how they treat their most vulnerable people.
The people that ran that place didn't think that he had anything they wanted, except when they needed him, because he was right, which meant that nothing else mattered. And they had to listen to him.
Wow, that 14-year-old House has so much insight into what's been going on. What's interesting though is that Hugh Laurie says that he has a negative mindset on the world as well. And while shooting House, he suffered with clinical depression, which he channels that negative energy into the House character so well. Can you imagine House played by someone else like Neil Patrick Harris? It just wouldn't be the same. Cringiest moment has to be when House said he didn't want to treat the patient in One Day, One Room.
I didn't mean to upset Dr. House. I like to keep being treated by him.
I don't want to treat you. There's nothing to treat. You're physically healthy.
I trust you.
You were raped, and all control was taken away from you. You're trying to find that control again. You want me because I don't want you.
I'm raping you. Get the hell out of here.
Well, stimulation.
It takes a serious lack of care for House to straight up tell his rape victim that he just doesn't want to treat her. Reminds me of Elon Musk's biographer talking about his demon mode when he can be brutally honest to achieve a task.
He gets into a trance and he can just be tough in a cold way. He never gets really angry, never gets that physical, but coldly brutal to people.
The most accurate moment's got to be Langerhans cell histiocytosis in the patient with dwarfism. The cancer autoimmune mix was just masterfully magnificent.
Just because we called her a dwarf doesn't mean she is a dwarf.
So what connects a long-term pituitary issue with problems in the lungs, liver, and pancreas?
Langerhans cell histiocytosis.
No way! I got that so early. It's my second diagnostic guess. I will take that. What makes that such an interesting diagnosis is, yes, it's classed as a cancer, but it also has autoimmune features as well. Wilson kept saying the patient had cancer. Cameron kept pushing for autoimmune, and the truth is it's both. Beautiful writing and diagnosis. It causes the abnormal growth in the dendritic cells, which we mentioned earlier. If one of the tumors affects the pituitary, then it could stop the growth hormone being released, which triggers the short stature. Treatment depends on the symptoms, but is similar to cancer with radiotherapy, chemotherapy, steroids, or surgery being used. Still can't believe I got that one. That diagnosis is about as niche as horse surfing. Most clutch house decision was actually done by Cuddy to load the lady in fetal position with steroids rather than giving up on the baby and going for delivery.
Firing the needle. The user's heart rate just dropped to 50.
Preterm labor. Started to butylene drip.
The contractions have subsided for now.
And the liver biopsy was negative.
Preterm labor can be a new symptom. The only organ we haven't been able to look inside is its lungs. The problem must be in
We've
there.
already got her on corticosteroids, but it'll take weeks
Then
for
let's
them to...
drown them in corticosteroids. And this is the kind of thing House does every day. I'll do it myself.
It's time to terminate.
Either get me a laryngoscope or get out.
Now the mom's lungs are shutting down.
I got the baby's lungs to expand.
These tissue buds are new.
If you're wondering why Cuddy's playing house, it's because he's going on vacation and she told him to get off early as she didn't agree with his plan to end the pregnancy. That's because she wants a child for herself and is around the same age as the patient, so is getting emotionally attached to the situation. When you lose objectivity as a doctor, it can make you do silly things like overdose a patient on steroids and trash the lungs to try and save the baby. Of course, in the house world, this will have a reason, but in real life, doing things like that have a disastrous consequence.
It's the mom. She's in VFib. Surgery's not doing this to her. The fetus is.
You keep going, you're gonna get electrocuted. Clear.
Heart rate's returning to normal.
Continue with the lobectomy.
Oh, we shouldn't be surprised. Houses always come with a barbecue. What's even more electrifying than Cuddy in this scene though is that the surgeon said the patient had CCAM.
It's definitely CCAM.
Do you know what CCAM stands for? Congenital cystic adenomatoid malformation, which was my final diagnostic guess. Can't believe I got that one. As I mentioned, the patient and baby's chances of recovering from this are very good after the lesions are removed. Chest is already open, so might as well take the lesions out while you're there. It isn't just me that outsmarted House here though. Cuddy had stolen the show by resisting the urge to perform the abortion. Most memorable moment is House touching the fetus's hand in fetal position. Overall best in terms of both medicine and storyline has to be Airborne. The double case, the mystery, the production value. If you want to remind yourself how good it is, then click here. Onwards for season 4.